Frozen shoulder can be really painful. Save this video for later. I'm going to show you a bunch of stretches and mobility that will help decrease your pain and inflammation. My name's Danny. I'm a personal trainer and I specialize in nervous system based body work, manual lymphatic drainage being at the forefront of that. I also worked as a licensed pharmacy tech for 11 years, so I have a lot of experience in all different realms of the medical industry. I've worked with hundreds of different kinds of clients, many of them experiencing frozen shoulder or breast tissue removal from breast cancer or different types of upper body surgery around the head, neck, and armpit area. So I have a lot of experience with rehabbing and releasing scar tissue. Keep watching if you want to learn some of those techniques. There's usually 3 stages to frozen shoulder, the first of which being the painful stage where it's inflamed, hard to move, and you feel like you're losing range of motion. This is the stage where you really want to focus on moving it as much as possible and reducing pain without medication as long as possible. Usually they're going to tell you to take anti-inflammatories or non-steroidal anti-inflammatories, NSAIDs like Advil, ibuprofen, Motrin, or they're going to, depending on the severity of it, offer a cortisone shot. Now, usually they say you only want 3 cortisone shots in a lifetime, but a lot of us end up getting more than that due to pain. So the number one thing I want you to start with when you're in this inflammatory, painful stage is lymphatic drainage. It is the powerhouse to pain and inflammation reduction. And if you're not already doing it, please add it to your regimen, no matter what kind of pain you're in. I don't care what stage of frozen shoulder you're in, you will benefit from draining the lymph from those areas. So if you don't know how to do upper body lymphatic manual drainage, go back and watch some of my videos. Make sure you're starting at the terminus. That's at the base of the neck here. You can either open up above this collarbone or below. We just need to relieve the pressure here. So open up all 7 nodes and then really spend some time draining the lymphatic fluid from this area. The armpit and shoulder area gets really clogged on a lot of people from improper chest breathing and just poor posture and not managing your internal pressure system. So especially if you already are in the painful inflammatory stage of frozen shoulder, it's really important we get circulation and blood flow through these lymph nodes in the armpit area and in the neck area so we can get better blood flow circulation and we can reduce that pain. So start with lymph and then come back and let's do the rest of these exercises. The first of these exercises is called circumduction. That just means you're moving something around in a circle. Our shoulder joint is a ball and socket joint, meaning the humerus, the bicep bone, sits into the scapula, that shoulder blade, like a little ball and socket. Here's the shoulder blade, here's the humerus, and it should be able to rotate. However, when that joint and that rotator cuff becomes inflamed, our range of motion is going to be locked up. That lymph fluid and that blood flow and all those tissues are gonna tighten up and become stressed out, and you're gonna lose that range of motion, and that's when pain begins. So we're just gonna start with some light circumduction. Hopefully you've already done your lymph. You don't need a prop for this, but if you have like a ball or a water bottle, go ahead and grab one. You can lean over a counter or just bend over. However, I'm gonna go, oops, I stepped on my dog. You can just I'm just gonna grab like my little podium here. You're gonna bend over without using any muscle control. 30 seconds to a minute one way and 30 seconds to a minute the other. So you're just letting your arm dead hang and letting gravity take over. And you're just kind of painting a little circle in the air both ways. So I'm only using this ball so I have a little bit of weight in my hand to help this movement. But just start lubricating that joint and letting your nervous system feel that range of motion again. So it's more comfortable here and it doesn't feel like it needs to protect you and lock up and tighten all those tissues. So this is number 1. You can do 30 seconds to a minute each arm. This next one is called a puppy pose. Now you can do this multiple ways. I'm gonna use a Swiss ball today to show you, and I'm also gonna show you how to do this on a wall. If you don't have a Swiss ball, you can use a chair, a couch, your bed, any surface that's about maybe hip height or so. So if you have a Swiss ball, it's gonna look like this. Let me back up and show you. So you're gonna get on your knees and put your forearms on the surface or the ball. Since this is a ball, it's gonna roll. And the goal here is to get your chest in between your arms and push towards the floor. So it's gonna look like this. You're gonna feel a really big stretch below your armpit. So butt up, chest down, and let your head drop between your arms. Completely relax all the muscles in your face, head, and neck. You can put your hands down towards the ball or rotate your thumbs out and away, palms towards the sky, and roll back in. You can hold that or do in and out for a few times. Hold it up to 2 minutes and just see what feels good. Let me show you how to do that on a wall. If you're doing this on a wall, I want you to take your fingers and walk them like little tiny spiders as high as you can go. Depending on what stage of frozen shoulder you're at, you may not be able to do the same range of motion I did on the ball. So slowly walk your hands up. Once they're up as high as they can go comfortably, place your forearms flat on the wall and then start to walk your hips back, doing the same thing you just did on the ball. So dropping your head and neck through your arms and spider walking these hands up the wall. Make sure to take deep breaths into your rib cage here. And relax all the muscles in your face and your jaw. You should feel a really big stretch below the armpits here, and that breath you take should expand your ribs outward. For this next one, you will need a wall. You can do this seated, but standing is probably better for you. You're gonna start with your arms out at this T shape. Your head and tush is connected to the wall, and you're just gonna slowly slide your hands up the wall and then down. Now, just my fingertips are touching the wall here. If you can get your whole arm to touch the wall, you probably don't have frozen shoulder right now. So you can do 2 sets of 8 to 10 of these, just sliding up and down, working on your mobility. Once you've done those, you're gonna come back to this goalpost position, and we're gonna work on internally and externally rotating our shoulder joint. So it's gonna look like this. We're gonna hands down and hands up. I'm doing my best to keep my shoulder blades, my head, and my tailbone connected to the wall. You can do 2 sets of 8 to 10 each way. Again, this may be really difficult or painful for you if you're in that super inflammatory phase. You will need a prop for this next one. You can use a pillowcase, a towel, a rag. You're just going to want to kind of roll it up like this, and then if possible, you're gonna throw it behind one shoulder. And then with your other hand, you're going to grab it. The goal here is to get your hands as close as you can together and really be pulling this bottom hand back behind your shoulder. This is where you're gonna feel the biggest stretch, is this bottom arm here. So you wanna hold that. You can move your neck away from that shoulder. Use your breath to get some oxygen in there, and then make sure you switch sides. So throw it over your shoulder. You're gonna reach behind with your opposite hand, and then do your best to work these hands as close together as possible. Again, you can pull the neck away from that hand behind your back. So this one may be a work in progress. Take your time on here and don't search for pain, search for relief. Use your breath to guide you deeper into the movement. This next one you may have seen if you saw my previous shoulder mobility video. Pretty easy one, but I'm putting it in this part of the stretching sequence because you should be pretty warmed up right now if you've been following along. This dog! She didn't like that. She said, I don't like that. So for this one, you're gonna take one leg and cross it over the other. And then that same side hand, you're going to do your best to hook on the opposite hip. And then this opposite side arm, you're going to twist, curve, move, and reach. Looking, so you're pulling this shoulder up and back. We're not letting this fall here. So do your best to open that shoulder up on the side of your head. Push your hip away from the twisted leg and reach. So I'm reaching here and reaching here. And then really move your neck, your shoulder, your elbow, your wrist, and your fingers. Do not make a fist here. And make sure to move your neck around and use your breath. And then you can switch sides. So you'll go cross, behind, hip this way, arm this way. You may get some cracks and pops out of your wrist, shoulder, and elbow. Spend as much time there as you need. And remember, the key to all of these is using your breath to guide the movement. Don't hold your breath when doing these. This next one is a classic doorway stretch. I'm sure you've seen or done this at some point in your life. So you're going to get against a doorway. You need to make sure your elbow is at a 90-degree angle or higher, but still bend it. And then you're going to place the crook of the elbow right on the edge of the doorway, palm flat, and then that same side leg back, opposite leg forward, and reach, moving the neck away. You're gonna feel a nice stretch on the front of this pec. This is very similar to the stretches we did on the wall with sliding up and internally and externally rotating. So in order to get that internal external rotation, you're gonna take this hand, I'm gonna show you the best I can, and you're gonna move it away. And this is gonna open up this shoulder joint more. So stepping through, leaning forward, neck leaning away, and then elbow pressed in, hand back. Now this may be really difficult for you if you're in the painful stage. So maybe don't do this part yet and just walk through. You can even back off of it, maybe pinch. So fingers into this pocket of the muscle, thumb on top, pinch that, pin, and then lean away. And you can move your neck around and maybe get some good cracks out of your neck. You wanna do both arms, so same side leg back, elbow at a 90-degree angle, step forward, lean away, and you can see this big pec muscle getting stretched. You can move your hand away from the wall for that external rotation. If you have access to this, you can do these next exercises. This is a TheraBand. I got this on Amazon. This is actually a really light one. I have a thicker one that's green that's a little bit more strong. So if you're in the really painful stage and you don't have a lot of muscle mass or muscle strength, probably go ahead and get the lighter one that's a little bit more malleable. I'll show you several exercises you can do for your forearms, shoulder, and hand with this. But again, if you don't have this object, don't worry about these exercises. So the first one, you're going to take it and keep your arms completely straight, and you're just gonna break this in half. So you can do 2 to 3 sets of 15 of these. You should be feeling this in all these forearm muscles. If you've watched my previous shoulder video, we're talking about that front deep arm fascial web of all the pec fascial tissue, the bicep, the forearm, and the thumb. This will help open up all that tissue as well. So 2 to 3 sets of anywhere from 10 to 15 of these. And then you're going to switch your grip. So we're gonna go palm to the sky, elbows straight, and then we're gonna bend it the other way. So now we're working the opposite muscles of the forearm. Make sure we're not like this. Pull your shoulders down and back and your chest through your arms. See how my chest is nice and puffy? I'm not here. So shoulders down and away from the ears, chest pulled through the arms, elbows straight, belly button pulled in. Nice tall posture. 2 to 3 sets of 15. This next one is also a form of circumduction. It's kind of difficult and a little phallic looking, so just bear with me. So you're gonna hold this straight out and create circles one way and then circles the other way. I know, a little phallic looking. It's actually harder on my bad arm. And this is just good for coordination and stability of the joint. So you can add that one in as well. And then we're gonna kind of hop to a maybe hip width surface or table height surface for the next one with the TheraBand. You will need a pretty decent surface for this next one. Honestly, this is not ideal for me. I usually use a big step up block. But you're gonna wanna have enough length of surface where your elbow can be on it, and so can the end of the TheraBand. So you're gonna have your palm towards the sky, gripping this face up with your palm, and you're gonna be holding at the end. From here, you're gonna kind of base this here, and then rotate. Again, we're working the forearm muscles, so I'm just kind of turning this up Now with my green band, this is a lot harder. So make sure your elbow stays pinned. And then we're gonna go the other way. So same thing, palm down now, grabbing at the end, elbow on the surface, hand on the surface, and we're gonna go here. So this, we're working all these top forearm muscles that connect up into that deep front fascial web of the arm. So this is gonna help create circulation and blood flow to all those tissues. For both of these, you can do 2 sets of 15 reps each way. This final stretch is shown in a previous video. I call this like half moons or crescent moons. I'm not gonna go into very deep detail of how to do this one in this video, since I have a whole nother video of how to do this, just like my upper body lymphatic drainage. So if you need to see how to do that, please go back and look at my content. It's labeled. You should be able to find how to drain lymphatic fluid from the upper body. And then this one should be, I think I started with like, get on the ground with your hands up now. So that video, I'm showing you how to do this in more detail, but here is a brief overview of what to do. And a couple people have said this has really helped them, so give it a try. This one, you will be in the fetal position with your bottom arm either hooking your top leg or underneath your head. You start with your thumb down on the ground, touching, and you're gonna try to carve a half circle around your body. Obviously, when you get here, your hand is going to flip and rotate. Usually when people get right here, especially if you're dealing with frozen shoulder, your hand's gonna be way up here. You're not gonna be able to do that at all. So in order to do this correctly and open up to get more mobility, it's really important you're in this position because the hip and the shoulder talk to each other. So we wanna turn this psoas muscles off by going into deep flexion. You're gonna take your 4 fingers like this, hook underneath that pec, and then thumb on top of it. Really grip that muscle. Don't let go of that pinch, and then try to retrace your circle. When you get to above your head, usually where you don't have as much range of motion, I want you to keep that pinch in the armpit, and then continue to move the elbow, shoulder, wrist, and neck, kind of mobilizing all those tissues. You may hear a lot of cracks and pops. Kind of get weird with it. Don't make a fist. Move that joint system in all different ways, and then retest your circle, and you should feel a great improvement in your range of motion. Again, if you need a more in-depth video of how to do that, please go ahead and watch the previous video of that whole thing that I filmed. But essentially, you are grabbing hold of this pec muscle and pinning it. I'm telling you right now, most people with any kind of shoulder injury, these pec muscles are gonna shorten and contract to protect you. So your body is going to wanna protract the scapula by bringing the shoulders forward, shortening these pec muscles. So really creating some compression on these and then moving through that tensional system, you'll release a lot of that like fascial adhesions and those areas that can freeze up during this type of disorder like frozen shoulder. Another modality you can add to your frozen shoulder regimen is mild heat, and even better if you have infrared light. That red light will help your cells regenerate quicker. It will create better blood flow and circulation, and warmth is always good for healing. Now, a lot of doctors will tell you, hey, I don't know why you have frozen shoulder. It's just something that happens. However, there are some risk factors that can lead to frozen shoulder. Diabetes and glucose intolerance being one of them, tobacco use, any type of shoulder injury or surgery, or any surgery from pretty much the chest, head, and neck, arm up. So yeah, there's not too much research. A lot of it has to do with like a lot of women in menopause get it when you have hormonal changes. Stress can bring it on. So just be aware that when you start getting that achy, dull, aching feeling in your shoulder, before it gets super inflamed and painful, try to get on a good shoulder mobility regimen to reduce the pain and inflammation and get you through this frozen shoulder a little bit quicker. They do say it can take anywhere from like 8 to 12 months. And if they don't see an improvement in pain or range of motion, surgery is usually the option, which I don't agree with at all. I think surgery should really be like the end all be all last option. So try to get on a good regimen. Let me know if you have any questions. And I hope some of these exercises and stretches help you out with your pain and inflammation.